Smile greetings. I am Tejal Uppal and you are watching my channel Learn Sujok for free. Friends, this is the first course with 14 videos to start learning Sujok. In this course, you will learn the correspondence systems of Sujok and begin the process of self-healing. In order to actually gain from this course, you must watch my videos in the order that they are given, chronologically, and also watch each video till the end. If you like my videos, then subscribe to my channel and press the bell icon next to it.
In the previous video, I shared the finger correspondence system with you, but I just want to continue with that and show you the placement of the organs on my fingers so that you thoroughly understand and revise the system again. Now, like I told you in the finger correspondence system, if you see here in the top phalange, you see this is the head, okay, on the yin side. The top part is the brain part, then come both the eyes, then the nose, and then the mouth. And the ears are on the yin-yang line of in line with your eyes, like they are in your own head. And on in the middle, the top joint, the center is your thyroid gland. The blue dot is the thyroid gland. And then when you go to the central, the middle phalange, in the middle phalange, this would be the colored one because it is on my right side. So this would be the right lung, and the other one, the one that is not colored, is the left lung. And between them, a little more towards the left, the blue part is the heart. This is the heart. So in the chest region, you have both the lungs and the heart. Then when you go down to the lower phalange, so on the right, you have on the right top of the lower phalange, right next to, this is the diaphragm line, and right next to the diaphragm line, this is the liver, and on the left side is the stomach. And right on top of the stomach, the blue dot is your spleen. That is the point where you will find the spleen. So if there is any pain in the spleen or any spleen disorder, this is where you have to look for a painful point and treat it. And when you treat it, your spleen will get treated. This is the correspondence for the spleen. And below the liver, below the liver, this blue dot is the gallbladder. This is the gallbladder. So any gallbladder issues, this is how you will place the gallbladder on the finger correspondence system. Then below that comes your LI. This is, this is the large intestine. And in between would be the small intestine. And absolutely on the joint here, this area, this would be the uterus point or the prostate point, and these on the side, the two other blue dots are the fallopian tubes, you can say, or the ovaries. This is the area where you have to treat if that any such problem is there. Now, if you see the yang side, in the yang, this is the skull. Then below that is the occipital region of the brain. And this would be this brown dot on the joint is the cervical. All the 7 bones of 7 vertebrae of cervical are fused into this one point. So if you have a pain in your cervical region, all you need to do is find a painful point over here on this joint. This is the joint. On the joint in the center, there will be a point which will be excruciatingly painful. Just apply a methi dana or a pepper seed or a magnet on that, and you will see that the pain goes. Yeah, that is the correspondence point for the cervical. And then in the middle phalange, comes the T1 to T8, till here comes the T1 to T8 vertebrae, the thoracic vertebrae, and then below that is the lumbar region. which is this is the T9 to T12 thoracic vertebrae. And then below that come the, I'll mark it with blue. The blue, this is your lumbar region. This is L1 to L5, your lumbar lower back vertebrae, which are the ones that pain the most, and especially for sciatica patients, this is where the problem is. So whenever there is a pain in the lower back or lumbar region, or if there is, some nerve getting compressed between L4, L5, or some vertebrae in the lumbar region, you need to apply seeds over here, find a painful point here and apply seeds over here. And below that will come the, below that over here will come the sacrum, and absolutely on the joint will be the tailbone. This will be the, in the center. This would be the tailbone. And the tailbone is, as you know, 4 bones fused together. So that is the tailbone. So this is how the organs are mapped out on your finger, and they are true for every finger. All 8 fingers, the organs are mapped out like this. Like this. I hope I've made this very clear now, because I had shown you the pictures, but I had not shown it to you on the fingers. So I thought I should show it to you before I continue with this other topic. Okay, now what I'm going to tell you is what we've understood in the previous video is only related to the central body, the head, chest, and abdomen. But where are the extremities, the arms and legs in finger correspondence system? The placement of all the organs and extremities in the main correspondence system are very simple. And even a child can see the similarity of the hand to the body. But in the finger correspondence system, we cannot see the arms and legs. But the information of arms and legs is there in the finger correspondence system. Body cannot be without arms and legs, yes? So the arms and legs are available in this system on the fingers, but in a contracted form. Each finger is showing the complete body. The front side is on the yin and side of the finger, and the yang back side of the body is on the yang side of the finger. The arms and legs you can see in the side view. When you keep your finger like this, arms are contracted in the chest region. The arms are attached to the chest, right? So the arms are contracted in the chest region, in the middle phalange. And legs are attached with the abdomen region in the lower phalange. So to understand this, we have to understand how this finger correspondence system was understood and developed by Professor Park Jae-woo. Okay, he explained it in this manner, that we have to understand the embryo position of a baby when he is just created. You have to imagine the baby's whole body folded or contracted, like, you see this picture in each finger of for correspondence. In the big picture with the baby, we can see the yang side of the baby and the yin-yang line on the side. This is the side view of the finger, the side view. The scalp of the baby is depicted on the yang side of finger as nail. Now notice how the arms and legs are organized. In this contracted position, notice how the shoulder, wrist, and other joints are placed. The wrist is in same line as the shoulder, isn't it? The elbow is in the same line as the knee, in the same position. And the hip is in the same line as the ankle. This system is also called the insect system, as Professor Park Jae-woo saw the insect posture in a newly born baby, where the baby has his arms and legs folded like an insect. So this was the insect position from which he derived the finger correspondence system. The shoulder joint is in line with the wrist joint between the head and chest and making a pair. The shoulder joint is towards the yang side and the wrist joint is towards the yin side. So if you see it on the finger, what will you understand? That the shoulder joint is between the head and the chest, right? And this is the joint, and it is on the side. So this is one point and this is one point. Okay. Now, which one would be the shoulder joint and which one would be the wrist joint is what we have to see. On this yin yang line, the point that is on the yin side, okay, would be the wrist. And the point that is on the yang side, the yin side would be the wrist and the yang side would be the shoulder. So this is the right side of the finger. So this is the right wrist and the right shoulder. And on this side, on the yin side would be the wrist and yang side would be the shoulder. So this would be the left wrist and the left shoulder. This is how it has to be understood on the finger. And when you see the knee, the elbow joint and the knee. So elbow and knee are like this, like, you know, the elbow is on, when you see the elbow is on top and the knee is, you know, down. So on the finger, in the middle joint, you will see that the point on top of this joint would be the elbow point and the bottom point would be the knee point. So on the right side would be the right elbow, right knee, and on the left would be the left elbow, left knee. And similarly, when you see the bottom joint, the hip joint, then on that, the hip joint is on the yang side. So it'll be on the yang side, and the ankle joint would be on the yin side. So this being the right side, again, you will have to understand that this is the right ankle and this is the right shoulder. Oh, sorry, right hip joint. And this is the left hip joint in the yang side, and on the yin side is the left ankle. The elbow joint and the knee joint are on top of each other, right? So elbow being in the chest area and the knee being in the abdomen area. So see these things very carefully in the body of the baby, as then you will understand exactly how to place it on your fingers. An ankle joint is in line with the hip joint at the end of the abdomen, again making a pair. The hip joint is in the yang side and the ankle joint is in the yin side. Now I'll show you a picture of the side of the finger, and so that you understand how the joints have to be placed, because it is very important when you have to treat the right knee. So you should know exactly on each finger that the knee is in the middle joint and the knee is the abdomen area and the elbow is in the chest area. So the knee would be the point just below the middle joint, right over here, and on the yin yang line. Okay, and this will be on the right side will be the right knee, on the left side will be the left knee. So when you have to place the right knee, this is the point. So whenever you have to treat pain in the right knee, this is the point on all fingers, and on this hand also, on the right side, this point would be the right knee for all fingers. And you can find the painful point out of all these, find 2-3 of these painful points and your knee pain will be absolutely cured. So in the yin side of the finger, first phalange has the face, second phalange has the chest and the lungs and heart, and the third phalange has the abdomen with the stomach, liver, and large intestine and small intestine. Here the arms and legs are opened to make you understand that there are arms and legs, but they are contracted on the finger. This finger correspondence system is very, very effective. Like when a person has multiple joints problems or when many organs are involved, then it is difficult to treat all the joints separately in the main correspondence system. But it is much simpler to treat these in the finger correspondence system. The joints are on both sides of the yin-yang lines of the finger, on the top and bottom joints of the finger. On the middle joint, they are above and below the joint. So I hope you have understood exactly where all the arms and legs and their joints are placed on the fingers in the finger correspondence system. The arms and legs, I don't know if I explained it to you or not, but on each finger, because the arms are in the chest area. So this is on the right side of the, the middle phalange would be your right arm, and on the left side would be your left arm, while in the lower phalange, the right side, yin yang line, would be the right leg, and the left side would be the left leg of the lower phalange. So you have your head here, and you have the right arm, right leg, then chest and abdomen, and your back of the body. So this is how it is depicted on each and every finger of your hand. So this is the finger correspondence system. Remember, and now again, my assignment is for you to practice these thoroughly on each finger. Understand the placement of all the arms and legs and all the joints. Remember, the more you practice, the more this knowledge will get absorbed in your mind. And soon you will not even have to think too much to arrive at the location of the treatment. So please practice, practice, practice for your sakes and others. See you in the next video, where I will explain how you have to treat diseases in the finger correspondence system. Some rules and everything. Thank you.